Okay, I'm going to get started with some introductions and we'll allow folks to join as they can. I'm Erica Nybro. I'm a Senior Strategic Communication Advisor at Johns Hopkins CCP, and I'm going to be kicking us off this morning. As you can see, we do have French interpretation available today. I'll show you where you can find that in a moment, but do say hi in the chat and let us know your name, your organization, and your country if you haven't already. And if you're a French speaker and prefer to be in a French translated breakout room, please indicate French in your introduction so that we know where to put you. So I put an example down here for myself. And I know we've all had a lot of practice with this, but we do want you to choose the language that you would like to participate in because we have French interpretation today. So please click on the interpretation icon at the bottom of your screen and choose either French or English. And it is important that you choose English, even if you are an English speaker, because when we're in the plenary room, if someone speaks in French, we will translate that back for you. If you're a French speaker, you're going to stay in the plenary room for the morning sessions because that is where we will have interpretation throughout. So before we launch into our sessions for today, I want to just quickly introduce the SBC for Service Delivery Community of Practice co-chairs. They include Kendra Davis and Heather Hancock from CCP. They're both on the line today and they'll be facilitating sessions, so you may see them. We have Manya Dotson and Sige Playa from Japaigo. Sige is with us today. Manya is not, but keep an eye out for them. And then Amy Dickerson, also from Japaigo. So some of you may not know what a knowledge cafe is, and really it's was originated when we would all be meeting live and where we would move around in small groups to learn about different tools in a sort of a hands-on way and in a very small group social interactive way. We will be doing our best to imitate that today in a virtual setting. You're going to hear from 4 different projects about 4 tools. You'll hear about the Social Norms Hub, that is from MSI, and Olivia Vanderpoot is going to be sharing that. The Tushikane package, which fosters client-centered family planning, is a Breakthrough Action Tanzania project, and Nima Isuja is with us today to share that. Then we have a transgender and gender diverse inclusion in family planning and sexual and reproductive health for service delivery. And that's from Agency for All, and Sonal Gianni is going to be sharing that one. And then finally, you'll hear about the most significant change activity from Alifia Somji from Japaigo. So our objectives are, yes, to learn about those tools, but more specifically, we really want to create the opportunity for you to interact with COP members in small groups and reflect on how some of these tools could be applied to your projects and really focus on those practical pieces. We want you to know where to go to get those tools and how they might be relevant for your current work or your future work. So feel free to discuss, and brainstorm and just be casual. We'll be in small groups and it's really meant to be kind of a low-key environment to explore. So our agenda is as follows. We're in a quick introductory stage now in this plenary room. Then we're going to have 20-minute sessions in our breakout groups. We'll come back to discuss in plenary, and we'll save a few minutes for closing at the end. I've tried to allow a couple of minutes between each session just to allow for some transition time and hopefully not have people feel too rushed, but we will stick to the 20 minutes in the sessions so that everybody can hear all 4 sessions. So the way we're going to do this logistically is you're going to be assigned to one of 4 breakout rooms, and you are going to stay in that breakout room. So rather than move all of us into different rooms, we're just going to move the presenters to you. So your breakout room will have a facilitator if we need any logistical help throughout, and the presenters will move to you. The Francophone participants are going to stay in this main plenary room because this is where we have interpretation. So hopefully you have had the chance to introduce yourselves in the chat and indicate that you want to be speaking French throughout the morning. If you haven't, or if there is a mistake in your room placement, it's not a big deal. You can just return to the main room at any time. You'll have an option to do that. And that main room is where you're going to have the French interpretation. We also are going to keep track of what room you are in so that if you have a technological issue and you get booted from the Zoom and you need to come back, my awesome colleague Shawnice will be able to just place you right back in the room you were so that you don't lose track of which sessions you were meant to see. So to be clear, once you're in a breakout room, you're going to stay there for the 4 sessions. Presenters will come to you. There will be a facilitator in the group if you need any help, and we will bring you back to the main session at the end of the 4 for plenary conversation. We are going to record each topic, each session in the main room so that we'll capture both an English version and a French version, and we will share those recordings and the slides after the meeting. So I'm going to pause and see if there are any questions or anything that's unclear before we kick off and move into rooms. Okay, well, I think then that I'm going to stop sharing. And I'm going to give Shawnice a moment to move us into rooms. Again, if you get put in a room and you need to stay in a Francophone room, you can just opt to leave that room and return to the main room for the French interpretation. So, okay, go ahead, Shawnice, and I'll see folks in the breakout rooms momentarily. Thank you, everybody.
Allô, on parle français ici, bonjour.
Bonjour, oui, moi aussi je suis francophone ici.
Ah, ok.
Merci.
Merci.
Chinese, I think maybe there was some confusion because Erica and I are supposed to stay in the plenary and Olivia should be presenting in the plenary right now.
I'm not a host. I could not assign it, so I had to move you to room 1.
Oh, okay. So, but then Camila
is in
can't.
room 1 too. She's in room 1 too. She needs to be caught in room 1. I moved her to room 1. She hasn't joined yet. Neither have you. I sent you both in room 1.
Okay. Can Camila interpret in a breakout room?
She should, yes.
Oui, ils m'ont demandé, mais moi je n'ai pas choisi la salle 1, je suis restée. Je ne sais pas pourquoi ils m'ont envoyé en salle 2.
Hmm.
Comment on peut retourner à la salle plénière?
On doit retourner à la salle plénière. En ce temps, il y a le bouton quitter. Quand vous appuyez quitter, en principe, ça doit vous... Mais c'est plutôt quitter la réunion. Nous sommes en salle plénière, je pense.
En tout cas, je n'ai pas accepté d'aller en salle 2.
Mhm.
Ils m'ont dit de me mettre en salle 2, j'ai mis not now.
Là, nous sommes en salle plénière.
Mhm. 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 Mhm.
Camila, are you still here? Yes,
Please, how can we go in the plenary room?
yeah,
Because I
Yeah.
didn't choose the room, but I am here. And in the church, I put French in capital
Okay.
letter.
yeah, it looks like, we had some difficulties because of assignments, but I think we do want to keep people in plenary. Let me just see if we can have the people in room 1 come back then. Just one moment. Yeah,
Okay,
Yes.
thank you.
yeah, that's my understanding too. Mhm. Okay.
Mhm.
Okay. Okay.
Mhm.
Sorry, we're trying to figure this out and get people back where they need to be. I'm sorry.
Mhm. Mhm. Hi all, we apologize. Olivia's going to get lots of great practice presenting. Camila, are we okay to go with Olivia?
Yes.
Okay.
Yes.
Olivia, you're going to have to share your screen again.
I am on it.
Okay, thank you. So sorry, everyone. Thanks for being patient.
That's okay. Thankfully, my presentation is quite short, so we will still have plenty of time, hopefully. So, hello everyone. My name is Olivia van de Putten. I am the Global SBCC Manager at MSI Reproductive Choices. We are an organization delivering family planning and safe abortion services in 36 countries across the globe. And I am very pleased to be here today to talk to you about our Social Norms Hub, which is a tool that, a set of tools that aims to make social norms theory and SBCC programming tools more accessible. So I'm probably preaching to the choir here, but I did want to start by taking a small step back to look at why social norms matter in SBCC for sexual and reproductive health and rights. So we can define social norms as the perceived informal rules that guide human behavior, that define what is acceptable within a given group or community. And social norms are so important in SRHR because they can often perpetuate gender inequalities. They determine who has power and privilege, and that really affects SRH. And it does that in different ways. So, for example, social norms affect individual choice, interpersonal communications, and joint decision making. So just to put some data behind that, research showed that across the globe, only 56% of married women have decision-making autonomy on SRH issues. And in sub-Saharan Africa, that drops to 36%. In Senegal, as low as 6%, which is quite harrowing. Social norms also create social pressure that impacts reproductive choice, for example, on which methods they use for family planning, birth spacing, family size. Our own MSI client exit interview data found that less than 3/4 of our clients in last mile delivery channels say that men are in their community are supportive of family planning. And that's because there's still a lot of gender norms creating male dominance of decision making on these topics, and also other norms creating a pressure to have large families. And then finally, social norms also impact acceptance and support for bodily autonomy and access to SRHR, especially for marginalized groups, for example, adolescents. In sub-Saharan Africa, an enormous 80% of young women don't use a modern contraceptive method. And obviously, that leaves a huge amount of unmet need. So all that to say is that research and our own experience really shows that effectively addressing social norms is a key opportunity to achieve that long-term change in SRHR. So I've already kind of explained then why we wanted to work on social norms, but why did that take the shape specifically of the MSI Social Norms Hub? Well, we had all the insights, the research showing that it's really important, key to ensuring that lasting impact of our interventions, and also to create sustainable demand for SRHR services. But the challenge is that social norms theory can be quite difficult to navigate, quite academic, or sometimes also not very practical. And we found that our teams can find it difficult to translate all of that theory into practice, to use the social norms theory to actually design impactful activities and programs. So our proposed solution is this online resource hub that on the one hand translates social norms theory into easy to understand language, using simple tools as well for this program design and guidance to inspire MSI teams. We will have a look at it after I've stopped talking, but as a little teaser, what is this hub? You can see it there on the right. So it's an online platform bringing all of this together. The audience can be anyone working on SBCC for SRHR, can be someone who is, you do have to have an interest for social norms. That's where we have to draw the line. But there's no experience level necessary. You can be a total beginner to a complete expert. The resources on offer are a set of practical tools to support the design of social norms SBCC. There's also guidance on insight gathering to inform social norms work, and guidance on monitoring and evaluation. There's also a growing library of external and internal examples of social norms interventions. And all of this is available in both English and French. We developed the Social Norms Hub through an extensive literature review of sector best practice on social norms. We then tested all the content and the tools with 6 MSI programs, and we collected a lot of internal stakeholder feedback, some external, but looking for more. So that is one of the reasons I'm here today. How have we used it so far? So on one hand, we've been using the program design tools in workshops to develop new SBCC activities that address social norms. And we've seen some nice impact from that. Between 2018 and 2024, community support for family planning has steadily increased. We can see that from our own client exit interview data. It's grown from 80% in 2018 to 90% in 2023, reflecting this growing focus on social norms in our SBC work. We have also used the theory overviews that are in the hub to train staff on social norms. And again, after training in Nigeria, we saw a lovely increase in confidence on social norms. The Social Norms Library has also been used to share best practice both internally and across the sector. And then finally, the hub has also strongly informed MSI's overall guidance on sustainable demand creation, which hopefully we'll share with you at a later date. Some things we've learned along the way. First of all, it's a worthwhile exercise. Taking the time to first really understand and analyze and break down social norms, even for teams who are super familiar with their context, it can be really eye-opening in terms of how they affect SRHR. We've also seen that turning social norms theory into practice needs participatory approaches. You'll see from the photos, we love a post-it note. And they can really help trigger conversations and reflections between people. And that really makes a difference from just having static resources on a platform. And then finally, building an understanding of social norms in SBC teams does really help identify new opportunities. We've seen that in plenty of ways, and I'm happy to talk about that a little bit more during the discussion. I'm sure you're all itching to take a look at it now. I'll just pop the link in the chat.
So we started
2
that
links,
time.
actually.
Yeah, I'm gonna send it a time. Started 8:40.
Oh, okay. Sorry, I thought that was a... So there is the link there for the Social Norms Hub itself. And what would be really lovely is to get some feedback and thoughts from you, either as yourself or by stepping into the shoes of some of the different user experiences that we've outlined on the slides. And just to see how you would use the MSI Social Norms Hub. Any feedback, any thoughts, any things we've missed, any things you like and don't like. To leave a space for that, we've created a Miro board with loads of post-it notes, which you can hopefully access through the link I've popped in the chat. And yeah, I'd love to invite you to just take a look at our hub. Let us know what you think, if you find it easy to use. And yeah, that's really it. It's slightly too big for me to do a big run through here, so I thought it would make more sense to just keep quiet and let you explore. And if there's any questions, please feel free to unmute, and I'll be here. Thank you.
Olivia,
And if
just I was going to say, just to clarify, I'm going to put the actual social norms link in there. So like you can see the website, and then the mural board pertains to the website, right?
yes, yeah, it does. Yeah, sorry, I think they all came as one message in my.
Yes, exactly. So just if you separate them, you can see the live
Yeah.
website, and then the feedback is in that.
Yeah, thank you so much. Also, yeah, if anyone has any thoughts they'd prefer to share out loud, please feel free. Yeah, I speak French, so if you prefer to write it in French in the chat, you're welcome to.
Hi, this is Sarah Rizzo from Living Goods. I just wanted to say, so thank you for this presentation and for sharing this tool. We're actually in the process of piloting a very small social behavioral change pilot in some of the communities that we work in, focused on family planning. And so I think I'm just looking through some of your tools and like the logic behind them and kind of the way that they lay out. Really, you know, kind of, I think, constructive thinking around how you're going to address these norms, et cetera. And I think this will be really valuable for us to be able to kind of leverage some of these tools as we're thinking about addressing some of these challenges. We've just got our baseline report back, and yeah, there's a lot that needs to be addressed. So I think it's really great. So thank you. Just want to thank you for sharing.
Oh, that's so nice to hear. I'm glad. We do actually have, if you've got a baseline report, the hub is a perfect place to go forward. We have some guidance on there on when you have that long list of things that need to be addressed, how you prioritize from that. We also, I think, what might be interesting are the Snap tool and the Power Quiz. They are two tools you can use to really analyze social norms and understand in what ways they're strong and in where there are maybe some opportunities to start breaking them down. And yeah, there's some M&E guidance on there as well, but we do have some like emerging thinking on that as well. So please feel free to reach out separately if you'd like to chat about that.
That sounds wonderful. Thank you.
Je suis Yolande Jazi de la Guinée et j'ai parcouru rapidement ces outils. La première page se traduit en français, mais après, quand j'ai choisi pour aller en français, ça continue en anglais. Donc, est-ce que c'est parce que nous sommes maintenant en train de travailler ou est-ce que c'est vraiment accessible en français?
I will respond in English, right? Yes, I'll respond in English. Unfortunately, we have had a bit of a technical glitch with the translation. So some sections are already in French, like the Jargon Buster and the library, but some are not. I really apologize for that. We were not able to fix it before this session. But if there is something that is very interesting to you, I have all the content in French in a Word document. So I'm happy to send that over. And all the tools should be translated and available in French as well. I apologize for the tech glitch.
OK, merci. Parce que ce serait intéressant de pouvoir les avoir en français pour vraiment être très efficace dans les pays francophones. Merci.
It will be fully updated again within the next few weeks, but I'm sure we can arrange separately. If you reach out to me, I'm happy to share the content with you via email in French.
Olivia, you said that some of this has been used in workshop settings. Do you have other examples of how it has been or could be used? I know you're asking people to think about how it could be used, but do you have other examples?
Yeah, so a lot of the time we are asked by a donor, for example, to develop an activity addressing social norms, and that can be very difficult. So the way we've used it so far in workshops is, so the hub essentially describes like a design process all the way from insight gathering to analyzing the norms to coming up with some proposed activities, and you can translate that to a workshop setting basically. So that's how we've used it in Nigeria. We have also used it for strategic workshops, so where the team has just gone over the mapping of social norms and then done some prioritization. And then they've put in their strategy for the next year to think about what they can do with that information. So some of these have been in-person workshops, but we've also, for example, facilitated the use of only the barriers tool that helps you think about different barriers to your desired behavior. And that was fine online. Lots of our SBC coordinators in country have also used this with their teams. We've really tried to design it in a way that you don't need anyone to explain to you how to use it. And so far, it seems to be going quite well. But yeah. I also just love social norms, and people know that. So they ask me if I want to join sessions anyway. Yeah, speaking of the case studies, if anyone has any others that they think should be involved, please let me know.
J'ai une autre question. Ces outils sont-ils utilisés? Je sais que c'est dans la communauté, mais est-ce que vous différenciez les groupes de femmes, les groupes de jeunes, les groupes d'hommes, les leaders, ou alors vous avez des séances qui prennent en compte tout le monde?
So the tools are designed to be used by country teams to design activities that can be implemented in whatever location for whatever target audience. The very first, if you run through all the tools in succession, the first thing that you will have to do is choose your priority target audiences and what you're trying to achieve, and then start thinking about all the barriers to that, and then narrow it down to which ones of these barriers are social norms or influenced by social norms. So we've used this actually more with, so at MSI, we often, speak to women, our direct clients, but the Social Norms Hub has actually been used more to design activities that talk to these secondary target audiences, like men, because it can be quite a big change for us. We're very good at talking to our prospective clients, but what about beyond? So yeah, it's definitely adaptable to whatever the priority is of the country team designing an activity or looking into social norms. I would say something on the fundraising as well. So very familiar with this challenge, but we have found that it's because the social norms theory is a bit more accessible here, it's become easier for a wider group of our staff to explain how social norms fit in, like how they lay the groundwork for that longer term change and the sustainability that a lot of donors are very interested in. You'd also see we have a section on like social norms that MSI are kind of approach outlined. It also helps that teams can use these tools to think through activities that they might not have funding for yet, but they take the time to innovate and then they have that ready for when a proposal comes up. That's been very effective in a few countries as well, to have those ideas in a wish list somewhere. I think I'm going to get kicked out in a second.
I was going to say, yeah, we're going to get kicked out any minute. Thank you so much, Olivia. That was great. The rest of us, we're going to stay put and wait for somebody else to move.
Thank you, everyone.
Thank you.
Okay, we'll be welcoming another presenter in just a minute. So, oh, there's Sonal. We'll give her a chance to get settled. And Sonal will share her screen in a minute. Take your time, Sonal, to reorient and start over. You're on mute, Sonal.
I am just trying to make sure I'm in the right room. They told me I think I am in room 4. Is this the correct room?
No. Well,
Okay,
it is not room 4. It is what used to be room 1, which got merged with the plenary to be able to do the translation. So
got it. I just got a notification. I'll move out of the room and I'll let you wait for your speaker.
Okay. Welcome, Alifia.
Hi, am I in this session now?
Yes.
Okay, great. Can you clarify how long I have? Because I'm not really sure based on the last process.
So you have 20 minutes total. We had to give a little bit more time last because we had to combine 2 rooms and start over 1 session. So please stick to 20 minutes now.
Okay. Okay. Hi, everybody. Welcome. My name is Alifia Somji, and I am a principal technical advisor with for measurement, evaluation, and learning with the Momentum Country and Global Leadership Project at JPIGO. Today I'm going to talk about the most significant change methodology, which is an adaptive management approach. We have several different parts of the adaptive management cycle. We have the prepare, where we work on theories of change, key strategies, and adaptive metrics. We have monitoring adaptively, and pause and reflection. I just wanted to highlight, I'm not going to go through the whole adaptive management cycle, but I did want to highlight that the most significant change methodology falls under the complementary qualitative information piece under monitoring adaptively. So the most significant change methodology was developed by Rick Davies and Jessica Dart. So you can see in this picture, the first guy here is saying we have this indicator that measures, and folks are saying, let me tell you a story, which means essentially indicators are great, but they don't really tell us the full story. So what is the most significant change technique? It's a participatory monitoring and evaluation methodology that involves monitoring without indicators, telling of change stories to peers observed or experienced, collecting of significant change stories at different levels. So at the community level, among program staff, and with other key stakeholders, developing domains of change, selecting stories which describe the most significant change and defining the reasons for prioritization, and providing feedback to program participants and staff. And what can we learn really from the most significant change process? We can develop a deeper understanding of the significant changes in the lives of the program participants and community members, which can be different from the implementers. So we as implementers might design a theory of change or a results framework or conceptual model that says, if we train X number of people, then we expect to see Y changes. However, in this case, we are asking the participants what they see as the most significant change that has occurred. And what that gives us is it gives us an insight on what they see, and that can be different from what we think we will see. So I'll show you an example of what I mean by this. We're also able to identify the stories based on different domains of change, which are themes or qualitative themes, if anyone's familiar with that. And then we're able to ground truth logic models or theories of change as well. Okay, so when do we want to use MSC? Most of our programs already have multiple components and diverse stakeholders. They focus on a social change, that it's participatory, it has repeated contact between field staff and participants, and it doesn't have a linear or well-articulated relationship between interventions and outcomes. So what MSC is not? MSC is not a communication strategy to develop success stories. So when we're asking participants on what most significant change stories are there, where the significant change can be either a negative change or a positive change. And MSC also should not be used to collect the same information that's already available from other sources. Okay, so now I'm going to explain what the MSC process is. It's a 6-step process. And I forgot to say this in the beginning, but if you have any questions, please do put them in the chat box. And of course, we'll leave time for questions at the end. Okay, so what I wanted to go through was in step 1 is where we formulate a question about a change. So I'll show you the formats of that, but we're asking essentially, in your opinion, what is the most significant change that has occurred in X and in Y time period? Then we break up the group into small groups. So the small groups have about 6 to 10 people per group. And each person in the group will respond to the story. And they will tell a significant change story. And then the group itself, after listening to all of those 10 stories within the group, they will select 1 to 2 stories that are the most significant to them. If we have multiple groups, let's say in some of our programs, in our India program, we had 10 groups, okay? So imagine that each group selected the top 2 stories. So in total, we had 20 stories that were the top 2. That's still a lot. So we go to the next level of the program, and we share these stories with a different group. So it could be at the regional level, at the provincial level, it could be at the project level, this is step 4. And they listen to those 20 stories, and then they do another prioritization process. Then what happens is all of the stories that were told are identified into different domains of change. And the domains are themes. Okay, so you could have domains on knowledge change, behavioral change, attitude change. And then step 6 is where we verify the story. We don't usually do this because MSC is a qualitative data collection methodology, and we don't need to, we don't generally verify qualitative data collection. So for example, if you're doing an in-depth interview or a focus group discussion, we're not verifying that. So this is really an optional step. So I'm going to go through an example of the use of MSC in Nepal. So in Nepal, JPICO integrated monthly MSC story collection among groups of female community health volunteers in Nepal who had been trained on identification and referral of gender-based violence survivors. And MSc was part of a larger study that also included focus group discussions, key informant interviews, and collection of GBV service statistics. So they looked at two MSc questions. The first was, in your opinion, what is the most significant change that has occurred in Mangalsan municipality for people affected by GBV since the involvement of FCHVs in the identification and referral of GBV survivors? And then the second question was, in your opinion, what is the most significant change that you have seen in your own life or work as an FCHV since you became involved in the identification and referral of GBV survivors? Oh, sorry. So FCHVs gathered into groups, they told their stories, and they decided together which story is the most significant. They also categorized the stories into domains of change. And then each quarter, the selected stories from the previous 3 months were reviewed, and the same group prioritized the top 2 stories. These selected stories from the groups were then sent to another level committee. They sent it to the municipal committee, which also met once per quarter to prioritize the stories. Okay, so essentially from this slide, I just want to highlight that there were different levels of prioritization. I'm not going to go through all of this. Essentially, all I want to say here is that the programs ended up with a total of 264 stories. That's a lot of stories over different time periods. And then through the different prioritization levels, they selected the top stories were the top 6 stories. So this was the analysis. MSc stories reinforced a female community health volunteers' role as powerful change agents. They had different domains of change. They saw 41% of the stories were under behavior change, 33% of the stories were under attitude change, and 26% of the stories were under knowledge change. This was at the end of the program. When they looked at the stories at the beginning of the program or earlier on in the program, they saw more stories under knowledge change and attitude change and less under behavior change. But these numbers shifted over time. They had different reasons for prioritizing stories. It's centered around the magnitude of change within families and communities. Folks were very involved and engaged in the story collection. And then these were the themes of the 6 final stories, okay? And so here is what I'm showing you. It is a menstrual hut, a chagot, and it's where women are isolated when they're menstruating, when they have their period, they go and stay in this hut, okay? And so this was one of the like GBV things that they were working on. And I wanted to share with you one of the stories that came out of this. I have 2 here, but I'm going to go through one in the interest of time. So I'm going to read it. In Mangalsan municipality, ward number 10, the Rali told all women were forced to live in a shed, chagot, during menstruation. After receiving GBV orientation by FCHVs, we discuss on this issue continuously and numerous times in mothers group meetings. Women in the community are now aware that it's not a good practice to stay in a shed during periods. Many women have lost their lives while living there. Therefore, we need to unite and declare this area as shed chagot free. We further discuss that every woman will develop their habit of staying in their own house during menstruation. At present, the number of women living inside of their house during menstruation is increasing in the village. Okay, so the program was successful in that they were not, staying in this chagot anymore, or there were more women living inside their own houses. But the program also found that women were still isolating, but within their own house. And that's not an effect of the program or an outcome of the program that we expected to see. So I wanted to highlight from the story that a lot of times MSc can show you what some of the unintended consequences are of your programming. I'm not going to read this story. Okay, so how are MSc stories used? So MSc stories are used as a monitoring tool to track changes in the domains and give critical information on how the program is doing. Able to identify unintended outcomes, which I just talked about, and revise the theory of change. To identify what other areas you might want to understand So you might use the MSC stories, for example, to triangulate with other data collection. You might want to do a little survey on something. You might want to dig in a little bit more with key informant interviews under a certain area. In this case, in Nepal, we also did some advocacy with the government where there were some changes in the GBV policy. And we had a paper that was published that included both the MSC stories, but also the quantitative data, and we triangulated all of this information, and there is a paper that is online on this. Okay, so I wanted to go through a little bit more detail about the different steps of the MSC process. So the first one is to formulate a question about change, okay? And here we're asking people about their perspective. We're asking about changes. So we're comparing two different points in time. There's a specified place or setting, a focused population or topic area, and then there's a time period, okay? So let me just give you a quick example. So here are some different types of examples of MSC questions we've asked. In your opinion, what is the most significant change that has occurred for pregnant women seeking care at your facility since the facility instituted respectful maternity care guidelines? Or in your opinion, what is the most significant change you have seen in your own work since you were trained on couples counseling? In your opinion, what is the most significant change you have seen in your own facility since the start of on-site mentorship? Okay, so I'm going to pause here and see if there's any questions so far on step 1 before I move to talk about steps 2 to 5. So feel free to put in the chat box or unmute.
Alethea, would you go back one slide and just show the information about the question one more time?
Yeah, sure. Sure. Okay.
Thank you.
Okay, so maybe I'll talk, you can put more questions in the chat box and I'll just go ahead and talk a little bit about steps 2 to 5. So steps 2 to 5 are really looking at small groups and people telling their stories, significant change stories. So I wanted to ask you guys, what do you think makes a good story? Think about stories you've heard as a child from or when you tell a story to somebody else. What are the elements that makes a good story? What do you need? Okay, being able to see a problem and a resolution. Okay, so there's a story arc, right? So there might be like a beginning, middle, and end in a story. There's an arc of the story. Great. Thanks, Heather. What else?
I would say some type of like emotional relevance, right? So that you connect to someone in the story.
Absolutely. So good stories are when you're able to connect to the main character and you have an emotional connection with them, right? You're able to identify with them. And that's great. Think about also movies or TV shows or things you watch, like what are the things that make a story enticing? Okay, I see Lauren is saying compelling characters and a transformation. Exactly. You want to be able to be cheering for the character. And so you want to know more about them and you want to really understand some of the challenges that they're facing as well. Absolutely. Thank you. What else? 5-minute warning. Yes. What else? Okay, so I will just go to the next slide. So, we talked about an effective character. We talked about a trajectory. We want the story to be honest and true, right? If there's a story that's it's all over it sounds too ridiculous, then, it's hard for us to really connect. So we want the story to be authentic. We talked about emotions and a way that there's action that we can follow and that there's a hook, okay? A lot of times we want to know what is really pulling us to that story. How do we connect? So when we're doing more significant change, the data collection piece of more significant change is a little bit more elaborate. Okay, unlike other qualitative methods, it can take about 4 to 6 hours to conduct more significant change with the data, with the participants, but the analysis is done during that time as well. So unlike other qualitative methodologies, the analysis is done during that time, and so it can be a lot faster on the other side. But there's a bunch of considerations, right? There's training, there's orientation for storytellers, there's cost, logistics, recording, transcription, translation. I mean, I have a lot of considerations listed over here. The idea is not to overwhelm you. Right now, we have other guides to help with this, to think through, but all of this, just to say that this is a methodology that is a bit more involved, that does need some planning. The training for MSc is about a one-day training. And it is more involved, and so it just needs to be planned and considered in advance. And then finally, I wanted to highlight some of the different tools that we have that are available. This is a lot of information here, so I might be biased, but I'm going to give a shout out to the basic toolkit. It's available online. It includes several adaptive management and learning methodologies, not only most significant change, and it's about 3 to 4 pages on each methodology. So it's easy to quickly read and identify whether that's something that you want to use for your project or your program. And then use that accordingly. We also have some like online pieces on that, and then some more details on some of the other methodologies in these other guides. Merci, Jacqueline. So I just wanted to see a pause here and then leave the rest of the time for questions. Or concerns? Or how do you think you might use MSc in your program? Okay, so I see we have a question on what level of training is needed to use most significant change in countries. And so in countries, we do a one-day training and often accompaniment during data collection for another day or 2 days. It doesn't have to be accompaniment for all data collection. It's just the initial MSc round where we helped co-facilitate or do some overall supervision coordination around it. And that's what we found to be the most helpful. But it is a one-day training plus some assistance during data collection for the first day. And then people can go off and do it on their own. And who can be trained? Ideally, we would want to have some folks that have some qualitative experience in doing, who have done, in-depth interviews or focus group discussions. It doesn't have to be that. I've trained all sorts of people. What we try and do also is we try and develop a set of master trainers that are not only based here, but based in different countries in the world, at least at JPIGO. So we have folks that are in different places that can also train people.
Thanks.
And Olivia, I think you're going to be moved any minute now, but
okay.
We'll have time to ask more questions and think about other ways this could be applied at the end. But I really like the way that you broke down those storytelling elements. I think so many of us tell these stories in different ways, and it's just I think it's a more exciting way to think about it.
Thanks, Erica. So when we do the actual MSc data collection, when we work with the participants, we give them a practice question and we really work with them to improve their storytelling skills before we move on to the real data collection. Because we don't want people who are better storytellers to get selected necessarily, which can happen, right? So we want people to kind of be at the same level. So we work with them a lot actually. So anytime someone tells a story, I give them a lot of feedback on how they can improve certain elements of the story. We might ask people to retell stories. We get other people to give them feedback. So it becomes a very sharing environment. And this methodology is very participatory. I will say in doing MSc in different countries, in different spaces, everyone loves doing this methodology. I'm not talking about the facilitators, I'm talking about the participants. They thoroughly enjoy it, even though it's so long. But it's usually people's favorite. Okay, I am being asked to join another room, but happy to take other questions when we move back. Thanks.
Thank you, Olivia.
Bye.
I believe Sonal will be joining us next, so we'll give her a minute. Hi again, Sonal. I think, hold on a second. I see Nima. Nima, I think you are not in this session yet. I think you're supposed to be in another room.
Yeah, the time is up there, so I was waiting for a call to join another room.
Okay.
Yeah, I've
Shawnee's
seen
will move
it.
you in just a minute. Hold on.
Yeah.
There she goes. Okay, so now when you're ready, you can feel free to share your screen and come off of mute. Welcome.
Hi everyone, my name is Tushikane and I work as a Senior Advisor Gender and Inclusion with the International Planned Parenthood Federation. And today I'm going to share some more information about a tool that we recently developed and are disseminating. Give me a minute while I open my PowerPoint. Can you see my screen, Erica?
Yes, perfect.
Okay, great. So yes, we have developed essentially two tools on gender diverse inclusion. And we were looking at creating these tools for gender diverse inclusion in USAID supported family planning and sexual reproductive health service delivery, as well as the research activities that are being conducted. And this was under the Agency for All project. So I want to tell you a little bit more about Agency for All. Agency for All is actually a 5-year project. It's on from 2022 till about 2027. It's a USAID funded project. And what it works is to generate evidence on the role of agency in effective social and behavior change programming. And effective social and behavior change programming to improve the health and well-being for individuals and communities. And the overall goal of Agency for All is to improve and sustain the health and agency for individuals and communities. And the idea is to improve and sustain the health and agency for these individuals and communities through locally led equitable partnerships that are focused on understanding agency within social and behavior change programs. So then the question is, why are we looking at creating these documents in the first place and for this community? So actually developing the inclusive products is important for several reasons. In terms of service delivery, if you talk about, the healthcare needs of transgender and non-binary people, they are often, their needs are ignored or they are not fully met. And even though there is new technology and it's helping, we still don't know enough. Just don't know enough about how to improve their healthcare. And that means that they don't often get the care that they need. And for research, transgender and gender diverse people, they are facing a unique problem. They are often included in studies, like it will be an external study, but that study doesn't focus on their needs, their specific health needs, and they're often sometimes also left out of very important health research. And the way that we measure gender in studies can also erase their gender. Plus, research is rarely designed or controlled by the transgender community, so it doesn't always reflect their true needs. So I'm going to take you through the two technical briefs, a little bit about them. As part of the project, two technical briefs were created to address this issue through a collaborative effort, and the collaborative effort was between the University of California, San Diego Center on Gender Equity and Health, the International Planned Parenthood Federation, and USAID. All of us, we came together under the Agency for All project. So the inclusion technical briefs, they are two distinct, but they are related documents. One of them focuses on clinical aspects, and the other one focuses on research. These briefs, they are designed for USAID and its implementing partners, especially in low and middle income countries. And the main goal was to review what's worked so far, and also provide guidelines to integrate inclusion into the existing or even the new programs. And these briefs, as you read them, you'll find that they offer very practical recommendations, and they highlight successful strategies that can be adapted to differing contexts. And we have both high income and low and middle income country evidence. And so it will demonstrate, principles that are effective across various settings. The content of these technical briefs, they were developed through a very highly consultative process, and that included a literature review, a review of peer-reviewed and guiding literature from international bodies. And along with that, we also had deep input and expertise from key informants, and we also held a lot of stakeholder consultations. We also, promoted, when the guidelines were being developed, we also promoted the tool and took in consultations from various events we were part of. So throughout, it has been very consultative with communities and stakeholders and international bodies. And that's how the document got developed. Now, when it comes to today, I'm going to be taking you through the service delivery technical brief, an overview of what's the recommendation that's coming through. I will not be touching on the research activities, but at the end of my presentation, I'll share a link to both the documents. Now, in terms of this, the first document on service delivery, the recommendations, they have been provided in 3 sections. So we've found that more or less we could group them into these 3 sections. The first section is family planning and sexual reproductive health and services. So what's coming up is the recommendations that are coming out of the communities and the interactions is that first, tailored family planning services, they are essential for transgender and gender diverse individuals. These individuals may still have the ability to conceive and they could experience unplanned pregnancy. Health providers, they need to offer inclusive counseling, and they also need to know and understand how hormones and contraceptives are interacting. It's important to provide information on fertility and pregnancy without making any assumption, ensuring that, the discussions we are having, they're always respectful and supportive. Additionally, services for gender-based violence need to be aware, the people who are providing gender-based violence, they need to be aware that there are the types of violence towards transgender and gender diverse people are unique, and they often face violence, and this includes harassment, physical and sexual violence, and even violence from family members or authorities. And so then providing compassionate and immediate support along with clear referral pathways becomes crucial. The second area that came up was grouping, was health setting and infrastructure. So to ensure that transgender and gender diverse people, they feel safe in health facilities, we need very strong anti-discrimination policies and confidentiality. We also need to, along with the client, we also need to protect healthcare providers from violence. And there's a lot of emphasis also on using respectful language throughout the settings. We can make the facilities more welcoming by displaying inclusive signs like the transgender or rainbow flag and having trained providers wear badges. We understand that some areas could also be hostile. So in hostile areas, you could use discrete signs and avoid gendered language that excludes people. It's very important to have gender neutral spaces like waiting areas and bathrooms instead of just women's or men's labels on them. So then this can make everybody feel comfortable. Finally, intake forms. Intake forms should let patients specify their name and pronouns very early on. And in the intake form, we should be asking about sex assigned at birth and gender identity separately. And then update the health records so that, we use the preferred name and pronoun. Finally, the third area is that the third grouping that came up was client-provider interactions. So what we're finding is that many health providers, they just don't get enough training on how to care for trans and gender diverse clients, because it could be for various reasons. It could be restrictive policies, limited resources. But it is important that you continuously do train service providers, and while training, it needs to be interactive with transgender trainers also. and with community groups, so that, they get to know more about focusing and how respectful interaction would look like. I mentioned this before, but using the correct name and pronouns, it makes a big difference. The staff should introduce themselves with their name and pronouns and then ask clients for theirs. And this kind of attitude should be consistent towards the client's care. Our client should be able to make healthcare decisions freely and without any pressure. And we need to provide all the necessary information, respect the choice. We need to recognize and address trauma impacts by creating a safe and supportive environment. And this was a big piece actually, because it kept coming up that it's important that training providers, they need to be trauma informed so that they can help mitigate stress and improve care for transgender individuals. It's very crucial to respect the transgender client by using appropriate language and avoiding intrusive questions. And so not to make any assumptions about the gender identity or the medical need. The best way around this is to follow the lead of the client on sensitive topics so that we can just ensure respectful and affirming interaction. So I'll encourage you to read our technical brief for more detail. I'm going to just put it in the chat. So you'll get to know more about the development process and dive more deep into the recommendation. So thanks for your time and attention while I presented. I'm going to stop sharing and open the floor for any questions that you folks would have. So please feel free to just unmute or, raise your hand. In the meanwhile, I'll just share the file with the guidelines.
So now I'm curious how this has been received, and has it been received sort of differently in different countries and different settings, and are providers embracing this type of guidance?
Right. So one is that, of course, the guidelines have been released very recently, only this year. So we also have to kind of see how the implementation goes about. But if you look at the guidelines in general from communities, even while during the process of building these guidelines, we were working with, at least at IPPF, with member associations, we've been working through these guidelines, and it has been it's been a very interesting journey for people. It depends a lot on the country context. We find that the guidelines really do help people who are organizations who may have some hesitancy on working in this area. So what we found is a lot of organizations did not want to work on being too visible because they were afraid that they don't have the right knowledge and they don't know the right way to interact and they don't want to be disrespectful and they don't know how to do this, right? So when we worked with member associations and guided them through the process, it's been a sea change. So I can give you a good example. So for example, we had a member association in Nepal, which was delivering family planning services. But after more sensitization and more training through all the guidelines that are provided, it actually now hosts the country's only transgender clinic, providing hormone therapy and providing gender affirmative services. On the other hand, if you have, say, a country like, we've had countries like Uganda or Afghanistan, there the work has to be differently. Like if you are working in, say, Afghanistan, they don't want you to use the word, training on LGBTQI+. Then you look at a different approach. Then you try to be, if you can't be that visibly speaking about diverse sexuality, then at least you can be gender neutral. And within the gender trainings, you can start folding in, this kind of stuff. If you look at the guidelines, it will tell you, it gives a lot of ideas and some really very fast actionable points. Yolande, are you saying something? I'm sorry.
Oui.
Erica, does that help?
Yes, absolutely.
En fait,
Yolande,
j'avais ouvert mon micro parce que je voulais poser une question. Je peux poser la question ou il n'y a pas de temps?
Yes.
OK, ma question était que l'oratrice a bien parlé du contexte, Je crois que le contexte est très important. Mais lorsque vous êtes dans un pays, par exemple, où même les normes sociales, le gouvernement ne reconnaît même pas la présence ou, disons, l'existence de ce genre de groupe, je crois que comment est-ce qu'il y a... Est-ce que vous avez rencontré déjà vous avez rencontré déjà des situations comme ça? Parce que je crois que ce sera difficile de venir appliquer des directives là où ceux que vous accompagnez ne considèrent pas ce genre de groupe. Est-ce que vous avez déjà rencontré des situations particulières? Et je voudrais que vous partagiez. Merci.
Thank you for the question. And definitely the guide does include, how to navigate in hostile environments. And it was important that we do touch low and middle income country because in these countries, there are environments where there is hostility. So like I mentioned earlier as well, there's a feeling that nothing can be done in a hostile country, but that's not really true. The communities, they are continuing to operate, they continue to exist in these countries, they're very much there. So one of the first, moves that we have actually, the first recommendations we have is that and you will see that within the guideline as well, is to be more connected with communities. They can actually help you navigate a lot of the environment. Secondly, okay, if you cannot directly provide services, at least a strong referral network needs to be created, where of, say, trauma-informed counselors that they could be connected to, or community-based organizations that, they could be sent to. And if you don't even have like LGBTQI plus clients, if you're not necessarily doing a lot of direct advocacy work, there are other very subtle ways to, kind of communicate that you are friendly, which communities do notice. So for example, something as basic as if you have washrooms in your organization, instead of calling it a men's washroom or women's washroom, just have one washroom just says washroom or restroom. So, that kind of slow building in of gender neutral language in communication can also start making you feel inclusive. So a lot of it also recommends that how can you make the setting more less binary and not necessarily at a complete champion LGBTQI plus champion stage. So if you will have a look at the guidelines, a lot will kind of come up for you in terms of these kind of recommendations. For us, we've navigated through countries with hostile situations by mainly working through communities, the advice through communities. And other than that, within organizations, if we have a strong confidentiality policy and the staff is sensitized to understand this confidentiality policy, that also incredibly helps. Then the information of the organization that it collects from the client can sort of be protected. So we always push for a sensitization of the employee before you give out any impression of service delivery that is going to, be LGBTQI inclusive, because you can actually end up doing harm. So always very important that, you work with the organization in the country, know their reality and work. And that's also because that can be a safety concern for the service provider and the organization. And that's something that the guideline does touch upon. So I will recommend that you give it a read. It also recommends other guideline documents for further reading in a particular area. So do have a look. I think we have 3 minutes more to go. So I think we can take comments, questions from 2 more people. So please go ahead.
No, you had recommended that providers especially receive training so that they are sensitive and know how to do all of these things that you're recommending. Are there training materials that already exist that you would recommend people look to or use?
So at IPPF, we ourselves have developed a lot of value clarification and attitude transformation related materials. There is also a lot of guidelines around, the services, HIV, whether it's HIV services or hormone therapy. But I will also say that first and foremost, it helps to actually look at guidelines created by communities in your own region. They make the most contextual and regionally appropriate tools, I would say. And I find that also a little bit because of the history of the HIV movement. They have communities slowly, their capacities have got built to bring these kind of tools to the fore, but not enough connection has happened with them. So I'm saying also this from the experience of belonging with community-based organizations.
Thanks.
I think we have about a minute remaining. Anybody else who wants to leave a comment or a question? So what I'm going to also do is I'm going to leave the link for the document just for your reference because these, in case you want to find them later, you can also find them on the USAID website and you can search for them. Find them there. I'm pasting the link in the chat. Just give me a minute. So they are quite easily available.
Thank you,
I think I
Sonal.
have to move to the next one.
It strikes me too that, you know, even though maybe this is becoming a more normative conversation in the United States, we still have a very, very long way to go here. And how many of these tools are quite relevant in all settings. So just to sort of say, you know, there are hostile environments here and friendly environments, right? And so, yeah, the importance of finding those allies and working safely is true, I think, in all settings.
So, you know, the main principle that we everything kept aside, like the one thing that you have to sort of remember is do no harm.
Yeah.
Yeah, keeping that in mind, then we kind of work further, like what will work, what will not.
Thank you. This is a good note to end on. Thanks, Sonal.
I think I'll have to leave the room. Okay? Thank you, everybody. Thank you for your time. We'll just
Thank
wait
you.
for the next speaker.
Okay. Okay, folks, we have one more to go. And I'm taking notes of things that I want to follow up on for myself. So this is really helpful. We have Nima with us. And Nima is our final presenter, and she's going to be sharing about the Tushikane project in Tanzania. So Nima, take your time to get organized. I know you're just finishing another one.
Yes. So should we start?
Yeah, I think we can start. You want to share your screen?
Definitely. Yeah, thanks everyone. You can now see my screen.
Yes.
Yeah, so as already introduced by the facilitator, I'm Nema, and I will be taking you through the Tushikane package, which means let's unite in English. So in this Tushikane actually is a Swahili word. So to begin with, we understand that, I don't know if my screen is, sorry, is it moving?
Yes.
Yeah, so while we understand that actually most of the effort to improve family planning services either focus on how healthcare workers provide or deliver services, counseling quality, client understanding options, but we see that we are lacking some of the tools which, address them simultaneous altogether. So I actually, in order to work with both providers and clients, to able to make the services be more client focused. So you can see the Let's Unite now, the Tushikane, it's aiming to to have a package which will make family planning services more focused on the needs of the client and help them make informed decisions. So far what is done, we were able to adapt some of the tools, that is empathy and compassion rounds. And we did this with different stakeholders in the country, the government, the USAID, the family planning providers, the clients, and the partners. Actually, we are able to, to adapt the tools to review and actually to organize and manage to have this intervention. You have seen it. That is Umoja, which is a client provider tool. The Pamoja, which means together, the couple games, and Kujijali, the self-care, which is one of the provider rounds. So I'll take you through. I'll start with, before that, just to understand that this intervention is taking place in Tanga. Tanga is one of the districts which is located northern eastern along the Indian Ocean. Actually, it's in the coastal area. These are the intervention sites. We have 10 of them, the facilities, as you can see there. So now let me take you through the Kujijali. Kujijali means self-care. You can see a picture of a provider who is a focal person. You'll understand in a minute. Yeah, so this is now Kujijali, the self-care provider round, which was adapted from compassion round. So actually these are structural forums for clinical and non-clinical health facility staff. And actually their supervisors in order to discuss social emotional aspect of providing care with the assumption that this will help providers to reduce stress, to increase motivation, and also to improve collaboration between themselves. So these are events which are taking place at the facility, and it's a 1 hour, 1 hour and a half, actually in a neutral place, and it's led by a focal person. And also, as I said, participant, clinical staff, non-clinical. We also, during the rounds, we have the panelists who their work is to share stories which are relating to the theme. So in each of the round, we have selected themes. They select themes for actually for themselves. And we have a steering committee, which they meet before each of the round, and also they meet after the round in order to, to prepare for the other round. So we anticipate each of the 10 intervention sites that I mentioned earlier will have one round. So we anticipate to have one round each month. These are the different tools which are used to execute the intervention. We have the description roles. I describe the roles and responsibility of the focal person, the clinical leads, the steering group that I mentioned. And we have the templates which are for the agenda. Each of the participants is having the agenda. We have a note taker template. We have this is one among my I'm very interested in this. I would normally like this key learning poster. So this is where they will display the key lesson from the round. So we anticipate after the rounds, when you go to the facility, you'll find this key learning poster, which is hanged. They select themselves where to hang the key lesson that they got from each of the round, depending on the space they have. So there's a feedback form, which is also given to each of the participants to write their reflections, and it's shared at the end of the session. So we have the round signing sheet, we have a badge. As I said earlier, this is the focal person, and you can see she's wearing a badge which is differentiating her from other participants. So what has been done so far is that we managed to have the first and second provider round. As you can see there from the picture, that is the focal person again. These are the participants who participated, and so far we have received very good feedback. There's very good acceptance of the rounds. We have seen the provider responding very positively, and they see these are a very good opportunity for them to, to release stress and express their frustration on a certain topic. So as I said, there are different topics or theme in each of the rounds. So yeah, that is it. And can I take you to another intervention, which is umoja? So the umoja means unity. Again, in this umoja, I don't know if you see my screen moving. These are activities that will encourage provider to offer empathetic, client-centered counseling, and make clients to share their needs and preference with the provider. So the key components in this umoja, we have the card deck. So the card deck is played once at the training. So during this training, we'll have a pair of family planning clients and providers. So they will, go around the cards and play during the training. And then we have another component that is the table tent. So this table tent sits between provider and clients during the counseling. And the main aim is to prompt provider to explore needs and preference, and also for clients to, to ask questions. You can see from the picture, that's the table tent. So it's folded. So one side is facing the client and the other side will be facing the provider. So for the side that will be facing the provider is to, to remind the provider to address the unique needs and preference to assist clients to make decision. And again, the side of the clients, just to remind the clients that he or she is free to ask questions for her to or him to receive, clients, which will be should select different family planning option. She'll have her own preference to feel free to speak to the provider. So, and at the end of the session now, the client is going to put feedback in the boxes. So you can see here, this is the box and this is the poster, which explain how to, to put your form in that box. So these are different materials that I was also describing earlier. This is the table tent, which is placed between provider and client. This is the card deck, which is played during the training. This is a one-time training, one-time event. We have a feedback poster. You have seen it there. Just to remind the clients to, to complete the feedback forms and place in the feedback box. We have the feedback forms. You have seen it, you know it. We have the facilitator guide, a guide for the facilitator, the family planning provider training, where FP provider and the supervisors will play the client provider in the deck. So what has been done so far? We managed to do the training, the umoja training, the one-time event I was explaining. You could see here, this is a pair of provider and a pair of a client. We're able to use the card deck together and, to understand different questions that are there for them to, to understand each of the role of everyone. And these are the audience, as I said, the family planning, healthcare provider with the clients. So far, what is shared is, they have effectively supported the concept of informed choices. So, going through the card deck, the clients could really comprehend now how to, to ask questions when they go to the facility, to understand their preference. And also it's going to empower clients in making decisions about their contraceptive use, their needs, and again, their circumstance. So I'll take you through again another intervention, which is the pamoja, which means together. So we know this is the series of events for the couples in order to communicate, to have a connection, and to prepare themselves for the next family planning counseling sessions. So in this pamoja, we have different activities, and we have 3 events. One event is, the first one is introductory event. This is just the aim to introduce the couples to the card deck. Also to, to help them get excited or interested to play with the card. And also to remind them, okay, after this introductory event, we're going to have another follow-up event. So the first one, they will meet, and then they will meet again for the second event. So for the first event, or throughout all these events, the 3 events, the facilitator is the CHW, who actually is also responsible in bringing the couples to participate to the couples night. So they'll be the one who are facilitating. So another event we have is the follow-up event, which helps the couples to to reflect on their discussion while using the card deck. They will meet for another event again. It's a 1 hour event, 1 hour and a half, 1 hour. Yeah, and also we expect to have another event, which is a celebration event. They meet to celebrate, they share the success, they get a certificate, and after that, yeah, we know that they have really comprehended, and we expect them to go to the facility now for family planning sessions. During the card deck, as I said, we have a card deck. This card deck has different rounds, which is the first one is Mambo. It's just mainly to break the ice. Mambo is it's like a greeting in Swahili. Mambo, hi. So the question here is just for them to connect, like, hey, where did you grow up? Yeah, question like that. And then there's vision, there's plan, there's prepare. So the card deck has these rounds. The Mambo, which is, you could see it's yellow, and then the vision, the yellow has changed a bit just to make them differentiate the round. So these are the materials now, which are there to execute the Pamoja intervention. The card deck I've mentioned, the card box includes the card deck, and it also includes the instruction and the note taking. There was a very good question from the other group which made me maybe to speak about this note taking. So the person was asking, what if a client will have a question and she wants to, maybe she didn't get, during the card, playing of the card with the partner, she had that burning question how are we going to help this client? So again, this note taker, she could write down their needs, she could write the question, and then maybe have it before the family planning session. He or she can handle this note taker template to the CHW, in order for her to receive whatever she was asking. So we also have a flyer. This flyer is to promote the couple nights. This is normally used by the CHW. They promote the couples nights in different areas. For men, they follow men to where they in their working areas. So they give them this this flyer, and also the facility, the providers during the Umoja visit, they can display, or they can, give these flyers to the clients. And also the CHW is using these flyers. So we have we have also facilitator guide, which is a guidance for those who are facilitating the couples nights. I said we also have a certificate which is given during the last event. So I can see our time is not in our hand. I'll just go quickly. What has been done is the introductory and the follow-up events, and these are very few feedback that are shared. That's, those questions or those games have been able to reunite their marriage. And also, some of the couples did not have a topic or did not discuss about family planning. So they just declare that they have been having an open dialogue about family planning, which are topics which they never spoke before. So this is just a staff consideration if in case you want to implement this, and this is the estimated fund. You can see a few of the roles, the project officers. We suggest one for every 4 facility, the mail, the finance, the head of programs, and also we have the estimated fund. For us, we did the adaptation, the stakeholders meeting, the implementation, but this is just based on the 10 facility. Baseline and end line, yeah. I just want to go deep into this. And also to make sure we capture and monitor this activity, we actually meet weekly for a weekly call. We also did a baseline before the pilot begin. And we are anticipating also to do an evaluation at the end of the Tushikane. And also we have this monthly supervision. So we go there, we have our checklist, we monitor challenge, capture lessons. Yes, and also these are the tools for M&E. We have the registration form in each of the intervention. We have the observation guides. This is used during the Kujijali and during the Pamoja. We have the feedback forms. These are just few of them. Yes, so this is, you can just interact with this material here. Like I've said, the card deck. This is the mambo, you know, the first round. What do you love most about your partner and why? What hopes do you have for a relationship? This is the vision part. So I think because of time, maybe we invite questions before the time knocks doors for us.
Great. Yeah, we have about 3 minutes left, I think. Any questions or feedback for Nima? Nima, I'll say I really appreciate that you shared some of the budget and those like considerations. I think all of us, when we hear an idea and we think, oh, that's great, but we just don't know what will be needed to do it ourselves. And I think this really helps put it in perspective. And I wish that more projects could share this kind of information. I know it can be sensitive, but in terms of sharing resources, I think this is really helpful.
Yeah, that's great. Thanks. Thanks, Erica. Yeah, I invite another question. Oh, that's great that everyone has really understood. Okay. So we have a few minutes left, so maybe I will proceed with, I don't know if my slides are moving.
They are.
Yeah.
Yeah, so this is just a part of, interacting with these materials. So this is the round I was explaining in each of the card decks, like the Umoja, we have the Mambo, the first round. So maybe let me call one person here to say what would she answer or he. Who inspires your life? Who in your life inspires you and why? So these are just few questions during the rounds, the Umoja rounds. So maybe maybe Sarah? Or anyone to volunteer.
I think we're about to be moved back in, actually. So
Okay.
hang on 1 second.
Okay.
And Nema, there is one question from Sarah in the chat, if you want to even just respond to that in the chat.
Oh, I didn't see it. Let me open my chat. Can you help me read it?
Oh yeah, sorry. She said, how did you mobilize couples to participate in the Pamoja piece?
Oh, okay. That's a great question. So how do we mobilize couples? As I said, we have a flyer that is actually used by the CHW. And as I said, CHWs are the one who are facilitating. So they are also the one who are recruiting the clients. They are also having this flyer, this one of our material here in order to promote the couples night. So for men, we know we have a challenge of men participation. So we follow them in their gathering, in where they work. These flyers are distributed there, but also during the Umoja intervention, the Umoja is the one at the facility, the provider is also giving the clients the flyers, so this flyers displayed there. So we have a way to get the participation, but mainly the CHWs are the one who are helping us to recruit these clients. Susan, have I answered your question? Okay, thanks a lot.
Nima, the other groups are going to start joining our rooms. So if you could stop sharing your slides, that would be great. And we'll go transition to our plenary session.
Thank you very much, guys.
Welcome back, everybody. I'll give the other groups a quick moment to come back to our plenary session. Thanks so much, and thank you for your patience as we navigated a few Zoom breakout room challenges. But I hope you all had a chance to enjoy the 4 really interesting sessions I got to see. We only have about 10 minutes left, so I'm going to turn it right over to Raheen Kankar from Ideas 42, and she's going to just share a few comments and lead us through a final sort of group reflection on what we've talked about today. Raheen?
Hey, everyone. It's been great to hear about all these different methodologies, and I just really want to open up this conversation to you all. So we learned about 4 very different and unique tools in the various sessions. So we heard about the Social Norms Hub, the Tushikane Let's Unite intervention package, the transgender and gender diverse inclusion guidelines for SRH and service delivery. And we also heard about the most significant change methodology. And so I'm curious to hear from you all, what are some possible applications of these tools to your projects? Were there any ideas that came to mind as you were listening to these different tools? And we also have Olivia kind of resharing the links to the social norms hubs and the Miro board if you want.
Something that's really sticking with me, maybe this sounds so obvious, but from the most significant change exercise piece is that, you know, I think we so often see sort of success stories or ideas move forward because somebody's a great writer or because somebody's a great storyteller. And the fact that that project is building people's ability to tell stories allows the truly good stories like to come out and voices to be heard that maybe we're not usually hearing. And so I think that's relevant to a lot of our projects in that, you know, starting from a different kind of place of making sure that people are really supported in telling their stories the best way possible, and then letting the best ideas rise to the top that way, instead of just kind of getting swayed by like flashy great writing, and so that must be a good idea. And maybe I'm not really capturing that properly, but I'm really thinking about that in my own work.
I'm really excited about the social norms hubs because I think it has so many different practical exercises and examples of how to do things. And I think that you could really easily use that in various instances where you're designing something new or rethinking your strategy. I think social norms are just, you know, it's one of our key areas for our COP because it is something that is challenging for a lot of people to think through, and how do we practice, like we know it's an issue, but how do we actually address some of those social norms? So I think that that's really exciting, if just very practical ways to put that into practice, whether it's just a design session or a training workshop or something like that.
Obviously super pleased to hear that. And yeah, if at any point for a future session, it would be interesting to run through like maybe a specific part of the social norms hub, because it is a lot. And I hope that people will have some time after the session itself to really explore at their leisure. And I'd love to hear what everyone thinks. Thank you.
I also want to give
everyone.
Oh, go ahead, Anaya.
Yeah. So I really I learned a lot from all 4 sessions, and the most interesting thing was inclusion and diversity, and being a trans person, being a transgender woman, I have faced a lot of issues while working in a corporate sector and working in different places. So these tools can be used um, for betterment of our community. And as Sonal said, that if you don't recognize that we're there, it doesn't mean that we're there. We are here, and it's time to, address these issues, and it's time to make new policies. And a very good thing which someone said was like even using right pronouns or even asking for the right pronouns is a very good step to initiate this. Thank you so much.
I'm just going to repeat back a little bit of what was shared. It sounds like we've all learned a lot about the power of storytelling and how leveraging the methodology can really enhance the way we share and collect information from communities. We've learned about the power of the Social Norms Hub and the different resources being really available at our fingertips. And then also in terms of gender inclusion, the power of even small changes around pronouns or changing signs to make spaces more safe and welcoming for everyone. It sounds like there's a lot of things that we can do to enhance our own project work based on these tools.
I'd love to give a shout out to Nima and the Tushikane project. I mean, in addition to being beautiful and I think really, really helpful, I really appreciated the fact that she shared detailed information about how they staff this project, how they budget this project. And I would love to see communities such as ours have it be more normative to share that kind of information, because I think that's really what can make it doable for us to know, what would it take for me to do this in my community? And really, I think is tremendously helpful. So thank you.
Yeah, and I wanted to add with the Tushikane project, it was so clear how much thought and intentionality went into the various different components, whether it's providers and clients or couples, and so kind of outlining the whole integrated approach into that package of interventions was really powerful to learn about.
We're about out of time, so I want to just say thanks so much to really, especially our 4 presenters. Thank you to our facilitators, and thanks to all those of you who attended. We will share via the listserv links, the recordings of the presentation in both French and English, as well as the slides. So please encourage folks who were not able to join to take a look at those materials and click on those resources. And yeah, that's it. Heather, Kendra, any of the other co-chairs, any other final announcements that you want to share?
No, just thanks everyone for joining.
Great. Thank you for spending 2 hours with us today, everybody. Have a great rest of your day.
Thank you, Erica. Thank you.
Thank you.
Merci, bye bye.